Basically, sleep apnea is apnea means cessation or stoppage of breathing. Now, it can be due to partial or complete obstruction of the airway, leading to stopping of breathing intermittently during sleep, which is then interrupted by arousal from sleep. This is what is sleep apnea. The types could be, associated with an obstruction in the pharyngeal level or the nasal level. There can be something known as central sleep apnea also, wherein the centrally the respiratory center is depressed. Okay, or there's something known as sleep hypoventilation. So these are the types of sleep apnea. But essentially, what we deal with in the majority of our patients are obstructive sleep apnea, or also called as OSAH. The most common symptom or rather complaint which the patient comes with is that his or her spouse is saying that the person snores a lot. So snoring is the first, the main symptom. Secondly, depending on the severity of the sleep apnea, whether it is mild, moderate, or severe, there can be additional symptoms like disturbances in the memory. There can be daytime sleepiness, so the patient does not have a very refreshing sleep, so he wakes up as tired as what he or she went to bed. Apart from that, there could be frequent urination in the night. Also, there are some metabolic issues that are associated, like the patient can have insulin resistance and leading to diabetes, associated cognitive impairment. There are mood swings, associated depression, anxiety, hypertension. All these are kind of associated problems that the patient might come with. But the most important one is snoring and daytime sleepiness. Basically, in sleep apnea, there are two things. One is snoring and one is sleep apnea. So some people may just have snoring because of some obstruction in their airway, and some people have sleep apnea. By sleep apnea means that their breathing is stopping intermittently during sleep, and there's an arousal reflex which is triggered from the brain to start the breathing again. Okay. Now, if you go to see the risk factors of sleep apnea, it's mainly obesity. So people who have a BMI of more than 28, usually also the male gender, because they have more fat, deposition in their neck, and the length of their throat and pharynx is more than women. Apart from that, some few races, especially the Asians, the Chinese people, or people with different abnormalities, craniofacial abnormalities, some syndromes. All these people are more prone to getting sleep apnea. But first and foremost, after a detailed evaluation of sleep apnea, what we recommend the patients is weight reduction. So regular exercise, weight reduction, some lifestyle modifications like the kind of food they eat, cut down on sugar, cut down on fats, increase the protein intake so that their muscles become stronger, start some form of strength training, at least 45 minutes of walk per day. Then the BMI has to be brought down to, somewhere between 24 to 26. That should be the ideal, at least the minimum BMI that they should be targeting. And apart from that, then if they are not responding only to these measures, then they resort to something known as CPAP, that is continuous positive airway pressure. Mainly the people who are obese, a male gender, and people of elderly age group. Because what happens in the elderly age group is the muscles are becoming weaker. Okay, so there are muscles which help the airway to be open. Okay, now these muscles are going to become weaker as they age, and which is why the airway is going to further collapse. So these are the people who are at mostly at risk, and then also people who have some abnormalities in the facial features, like who have like a some people have jaw which is a little behind. Okay, the oral cavity, the tongue is very big, the palate is big, so these people are then prone to having sleep apnea even if they are not obese. It's considered chronic because the kind of obstruction is not, if it's not getting relieved. So obstruction can be at different levels. It can be at the level of the nose, wherein it could be something as simple as a deviated nasal septum or enlarged turbinates, or someone with allergies, who have a little swollen mucosa and a stuffy nose, or it can be due to enlarged tonsils, bulky tongue. So there can be obstruction at different levels, which until and unless, acted upon, is going to remain the same. Okay. Plus, these people have associated problems. Like, as I said, they are obese. So till the time you bring down the, BMI to the desired range, they are going to be having the problem. So it's a problem which lasts really long and requires treatment and, all the measures over maybe months together to get them back to normal. That is why it is considered as a chronic condition. About dietary changes, as I said, we are target to reduce the weight. So reduction of the weight, the first and foremost thing is cutting down on sugar, because with high sugars, your body is craving for more and more sugar, and that eventually leads to weight gain. Apart from that, cut down on carbohydrates, because if you have a sedentary lifestyle, your carbohydrates are not going to get utilized. They are just going to be converted, so increase the protein intake rather, and so that this helps in building muscles. The muscles get stronger, which can hold the airways, also become stronger in that way. And plus, with less fat deposition around the neck, the risk of the airways getting collapsed during sleep is less. Also, I would recommend sleeping on the left lateral position, because that is considered as the best position which for sleep apnea. Sleep apnea, the first thing is lifestyle changes. If that is not helping in moderate to severe cases, we start with CPAP, and eventually if CPAP is also the person is not responding to CPAP, or there is a obstruction at multiple levels, then we look for surgery. Surgery is always the last resort, even in obstructive sleep apnea, because the surgeries are they are major surgeries, and they can be associated complications and comorbidities.